So just to get things started, can we get your first, last name, and title here?
I'm Diane deBruyn. I'm one of the partner veterinarians at Mission Veterinary Hospital.
Let's talk about heartworms. What are they and how many cases do you guys see here a week?
Heartworms are exactly what they sound like. The adult worm lives in a dog's heart. That's how it got the name. We see several cases a week. We try to test every dog at least annually to make sure. But on an average week, we may get 2 or 3 positive cases.
And so what do these heartworms do to the animals?
If you get down to the most basic function, the heartworms live inside a dog's heart. The heart's a pump. Its job is to pump blood. And so if you think about filling a pump up with worms or clogging the pump, eventually dogs will go into heart failure. The other thing that happens is when the worms die, they actually get pushed into the lung field and you get a lot of scarring and damage in the lungs. A dog that comes in that's positive and in later stages of heartworm disease, I like to call them old smokers because lots of times they're kind of skinny and scrawny. They tend to have kind of a phlegmy, hacky cough. And then when we listen to them, lots of times we can find that their heart's not functioning very well.
How do heartworms spread?
Heartworms are spread by mosquitoes. And so a mosquito will bite an infected dog. It will pick up a baby form of the heartworm that's called a microfilaria. It actually goes through a life cycle change in the mosquito, and then it flies over the fence, it bites the next dog down the way, and when it's feeding on that dog, the microfilaria basically go inside underneath the dog's skin. It takes about 4 to 6 months while those baby heartworms of microfilaria are migrating through the dog's body until they develop into the adult stage, which is in the heart itself.
Is there a threat of this happening to a person?
It's not impossible, and there have been documented cases, but pretty much a person needs to be very immune compromised, and it's not something that's very common.
So what are some symptoms people need to look for in their pets?
The biggest problem with heartworm disease is that the initial symptom is no symptom at all. And so by the time we do see symptoms of heart failure or of lung damage, that damage has been done to those organs. So if the heart is in failure after heartworm infection, we can't fix that damaged heart. And so most of our treatment and most of our diagnosis for heartworms, we're trying to catch these dogs proactively before they're actually sick. So we like to do heartworm checks every year, and the heartworm test is looking for proteins from those adult worms. And so if we get a positive test, we know that a dog has adults in its system. If we're catching a dog before they have any symptoms of disease, then we can actually get rid of the worms and cure the dog before we have that permanent damage.
So that's sort of the best thing, an annual check?
Yeah, the best thing is to check annually and to have dogs on heartworm prevention every month. The heartworm prevention kills those baby worms. It kills those microfilaria before they can develop into the adult stage in the dog's heart.
How fatal can it be if you wait too long? Say you wait till you finally start seeing symptoms.
If you wait until you see symptoms, some dogs can still be treated, but then we have lifelong treatment for the symptoms that the disease has created. So if we have heart failure, eventually we're going to lose most of those dogs to heart failure. If we have severe damage to the lungs, then we can have chronic coughing and diseases kind of like an emphysema in people would be.
Anything else?
Heartworms is not only a dog disease, it also occurs in cats. We feel like the percentage of cases in the valley is probably between 10 to 12% of positive cases in dogs. It may be as high as 1 to 2% in cats, so it's not as frequent in cats. But because they're not the normal host, if they develop even one adult heartworm and it dies and gets into their lungs, it can be fatal in cats.
Anything else?
There is treatment for the adult worms if they are positive. It is a very prolonged and extensive treatment because when we kill those adults, that protein from that worm has to get flushed out of the lungs. And so it's a months-long process to treat them. So it's much better to start puppies when they're young on the prevention, to test them and keep them on prevention their whole life so we don't have to worry about going through that whole process.
I know you said a couple months. Do you have like an average of how long treatment lasts?
When we first diagnose heartworms, we put them on a treatment course to get them ready for the therapy that kills the adult worms. Then a month later, we bring them back, we give them an injection. They have to be kept very calm and quiet during that period. They come back a month later, they get 2 injections of the medication, and they go home on confinement again for another full month. And then it is 6 months later that we retest them to make sure that we were able to get rid of all the adult worms.